not enough. And fine-tuning that and figuring it out is key. Now, you always need a baseline on your blood work, and a lot of people will just make assumptions because I feel this, I feel that, I feel this. Just because you're tired, for instance, doesn't mean that you need TRT, but it may. There's a lot of symptoms that you could have that could fall into a lot of categories. So that's why it's important to be very thorough in your blood work, your panels, and to find the right practitioners or doctors or clinics that you're going to go to, because some are just out for money and some actually care. One of the things that Dave said that I thoroughly agree with is things that are misprescribed. Now, unfortunately, a lot of doctors are under pressure from their insurance companies, and if they don't prescribe X amount of certain drugs, or if they do prescribe too much of one thing, they can get their insurance pulled. This is a fact. It's 100% fact. I know it because I know plenty of doctors and people that work in the drug industry that have confirmed this for me. So that's another thing that you're battling. It's a non-stop battle. One of the keys is to do your own work. Be diligent. Ask questions. Go do your own blood work if you're not getting the test that you want. It's easily accessible now. There's plenty of places that you can go do it for cheap without insurance. There's a lot of things that unfortunately people just don't know that are out there, that are outlets and tools that we can all use and do to take care of ourselves. Because unfortunately, if you don't do a lot of things yourself, nobody's gonna do it for you. You go in somewhere and they're very quick to throw you on something and kick you out and tell you that you're okay, but nobody can tell you how you feel except yourself. You just have to dig deep enough into the underlying conditions and find out if that's exactly what the problem is or not. But just a question of, do we need TRT? Well, yes, some people do, and no, some people don't. Some people are too quick to jump on it, self-prescribe it to themselves when they don't need it. And some people don't realize they need it because they just don't understand or they don't know. Even though there's more education out there now, there's still not a lot. And so another problem is the bad information and sifting through it. It's one of the things I battle with what I do, is I'm making videos and I'm doing these, but I can get stigmatized into a category because so many people are doing something with other motives as opposed to just trying to help people. And that's another, entire issue of sifting through things. But when we're just talking about your body and how you feel, every single person is different. What kind of dose you need for TRT? All three of us, we're gonna probably need something different. Our